To you all. I welcome all the participants to this live session on tuberculosis and women. Today we will discuss about various challenges faced by women in dealing with TB and access to TB services, social stigma, social barriers, and other social issues related to this concept of TB disease. And today we will also learn about various steps and initiatives taken by the state government in dealing with TB, especially by engaging women. This is Swetha Karanam. I am a Child Development Project Officer in Women and Child Welfare Department, Government of Telangana. And we have with us today Dr. Rajesham Garu, Sir is State TB Officer and also Joint Director. So thank you for joining us here on this platform to share your valuable views and also insights in dealing with TB, especially by engaging women in TB elimination efforts. We all know that India has the highest TB burden in the world, and we also know that TB can affect anyone and everyone. It does not discriminate between younger or older people, or rich or poor, or men or women. More so, women are more vulnerable to this disease of TB due to various reasons, such as due to lack of mobility, due to lack of various financial resources, and various other reasons. In this background, sir, can you please give us the background of this disease called tuberculosis and its impact on society at large? Yeah. Over to you, sir.
Thank you, Swetha Garu, for inviting for this gender responsive session on TB. Very much thankful to you. As you said, TB is a most almost it takes almost the global burden. So TB is a infectious disease. We call Shaya in Telugu. It is a contagious disease, and when a TB patient, whenever he coughs or sneezes, the bacilli come out from his through his droplets, and whenever the normal person inhales those droplets, he will get infection of TB. And TB can be infected to anyone. It doesn't differentiate between poor and rich, or old or children, male or female. It doesn't show any differentiation. It can cause to anybody. It occurs in a vulnerable population where the people live in crowded places, slum areas, and where the people have low immunity, and where the people they are having comorbid conditions like HIV, diabetes, and chronic diseases. These people are more vulnerable for TB infection. So, according to one survey, 40% of the adult population of India is infected with TB. But out of that, only 1 to 2% will be converted to disease. So, because of immunity levels in the individual and because of the weather conditions, all those things, only 1 to 2% of the infected people will be converted to diseased persons. Remember, TB is completely curable, but the patient has to take entire treatment protocol and he has to adhere to the treatment schedules.
Okay, sir. Thank you. Sir, in this context, I would like to ask you, what do you think are the greatest social barriers in making medical systems and more gender responsive and gender sensitive, given the fact that TB affects women in more disproportionate manner?
Yeah. Mostly stigma and shyness or shame of disclosing the TB symptoms, especially in women, and their accessibility to the services and affordability of the treatment options, all those things. And you see, women, the health seeking behavior is the very much low in India, and they think that, especially in marriageable age group, they think that if it is known to others, their marriages will be affected. And if any woman having children, if she is known that if she is having TB, she may be abandoned from the family. With this type of uh, stigma and this shame shyness, so they will not seek health this thing. Then they don't know availability of facilities and accessibility. They have to go for they have to travel far away for the diagnosis and treatment, all those things. And main involvement in mostly in hospitals or in treatment centers, and it is also this thing. And lack of women empowerment also one of the most common cause for this gender disproportionate thing towards women.
Okay, sir. Thank you. Sir, we are still in this COVID-19 pandemic situation, as all we know. And I think COVID has made us learn so many lessons. And it has also brought to the light the plight of various vulnerable sections of society, especially women, sir. In this context, how can we be more sensitive and responsive to the needs of women, sir?
Yes, as you said, COVID has learned many lessons to us, and it is posing many challenges to us. So you see, the symptoms in COVID and TB are similar, like cough, pain in throat, fever, other very common symptoms. But they most bother about COVID rather than TB. So this causes more spread of TB among the people. Then to overcome all these things, you have to build up a proactive healthcare system instead of reactive healthcare system. See, now we are reacting to COVID pandemic, how to control it, all those things. And we have to build our infrastructure and HR systems in primary and secondary care uh, health systems. So if we improve our facilities like infrastructure and HR at primary and second level, we could control the pandemic, other disease also at primary and second level only. Okay. Then the government of Telangana is taking many steps towards this gender responsiveness in controlling TB, like engaging the community and involving the women in the community engagement.
Yes, sir. Thank you, sir. Sir, we in government, we believe in coordinated approach and we believe in coordination with all our line departments, sir. In this context, how can various departments can coordinate amongst themselves to and come together to end
Yes.
TB, sir?
Yeah. See, it should be like Janandolan, like public movement. So all the stakeholders, all the partners should be on one platform to eliminate TB by the year 2025, as our India is committed to end TB by year 2025. So that all stakeholders, all partners should come on one platform to fight against TB. So, and exploring all the social welfare schemes, direct benefit schemes, whatever available for the women, they should be made available to the women as well as other, with along with other um, patients. Okay. Then collaboration with the Women and Child Development Department is a good example. So Telangana government is taking a step in collaboration with the Women and Child Welfare Department. They are running Ujjwala homes and Swadhar Group in entire Telangana. So in cooperation with the Women and Child Department, we are doing active case finding in all these Gruhus and Ujjwala homes to find out the TB symptomatics and TB patients.
Okay, sir. Yes, sir. Sir, what are the concerns with regard to TB, especially in workplaces, sir? Especially concerns with regard to working women or women workers.
So female employment ratio is much more in many industries like textile industry, agriculture industry. So since female workforce is very high, so during these workplaces, the company should take uh, and they should provide this women and other children uh, facilities like TB diagnosis, TB treatment, other facilities they should be able to access. uh, and they should allow to take dots. We call it DOTS dots, directly observed treatment short course. Where the patient is diagnosed, we give full course of treatment at a time to the dot provider, and these companies or the head of the that company should allow this dot providers to give the treatment at the workplace. And during this disease period and during this treatment period, they should be paid. So they should not be deprived of their payment.
Thank you, sir. It was nice to hear. Sir, what has been your experience in dealing with cured TB patients, sir? Like we will say TB champions,
Yes.
especially women TB champions, sir. And especially in terms of advocacy and creating awareness to other TB patients and survivors.
Yeah. So Telangana State TB is actively involving in community engagement, and we are trained cured patients as a TB champions, and we are using these TB champions in creating awareness among public, using them in community engagements, and we have trained so many women cured patients also the TB champions. We are using their uh, services also in the community engagement this thing. So they will create awareness among the community, and they talk about stigma. They talk about how they defeated TB, how they become champions. All those things they will explain during Grama Sabha.
We'll handle. Okay, sir. Thank you, sir. India is aiming to end TB by 2025, sir. That's a very big target for us, sir. So, in this situation, how critical is the role of women in dealing with TB care and control as supporters, educators, and providers?
Yeah. So Telangana has taken many steps to improve gender responsiveness on the TB national program. So we have more than 12,000 gram panchayats in Telangana. In each gram panchayat, we have created one TB club. The TB club contains pure TB patients, and it is under the chairmanship of Sarpanch of that village. And in that club, all the cured patients, especially women cured patients, and all the public representatives, women public representatives are the members, and village level workers like Ashas, Anganwadi teachers, and women teachers in school, all are the members of these TB clubs. So during Grama Sabha or TB club meeting, these women they raise their voice in the meetings, and they will explain the what are the symptoms, so how to deal it, how to get the cure from the TB, all those things they will discuss during Grama Sabha. So we have trained them at the Hyderabad level, and uh, we are using these cured TB patients in Grama Sabha meetings. And actually, one of our women cured patient, Mrs. Farhana, is also trained at Hyderabad, and she got appreciation from our Honorable Governor Tamil Sai Soundararajan. So now I request Miss Farhana Sheikh to share her experience. So how they are.
Over to you, Farhana.
Very good evening to one and all here. Myself, Sheikh Farhana. Actually, when I suffered with this TB, I just want to share my experience, what I suffered during this period. So, actually, I was working in one of the private school. Now also I'm working. So, when I used to go for job, I started there. I doesn't know it is exactly I suffer from tuberculosis or what. So, there near my area hospital, I find I showed to the one of my family doctor, and they said you are suffer from tuberculosis. So I roam many hospitals like private hospitals, जो कि मशहूर hospitals है. So I went there for the treatment. So I just say the name of that hospital. It's Mahavir Hospital. There they said you have to go something like this. So after that. I used to went many more hospitals. And finally, I used to went my area. That's a government hospital. I find one of the sir. Her name Prem sir. So said me, he gave me the treatment. 6 months of course is there. So he gave. Then after that, I used to to that hospital, tuberculosis hospital, which is near Hiragata Hospital. So there I admitted for a 1 week. Then they said after completing my treatment, I was back. I just want to give the message to the TB patients. They should not get worried. It's a curable disease. First and foremost, the patient should know it's a curable disease. And what the people think that we're looking here only. They used to keep like this in their mind. So we are suffer from TB. We can't get forward. It's not like that. We should aware them. Like it's a curable disease and all. Thank you.
Thank you, Farhana. And sir, thank you so much. That has been a very wonderful session, and you have given us much information about the steps taken by the state government in handling TB and also way forward, sir. And since I come from Women and Child Welfare Department, I would like to tell you all that we have various homes, shelter homes running by the state government in coordination with central government. We have 21 Swadargrahas providing shelter to victims of women in difficult circumstances. We have 4 Ujwala homes and we have 1 rescue home. And we have various such shelter homes providing shelter for trafficked victims and other destitute women. And we thank you, sir, for sending your team to all of our homes and providing them basic understanding and counseling and giving them support in diagnosis and treatment, sir. And thank you, Rajesham sir, and thank you, Farhana. And I thank Department of Women and Child Welfare and also Department of TB and State Department.
Thank you, Swetha Garu, for this very good elaborated Facebook live show, interactive show. And I'm very much thankful to Farhana, who is a game changer. These efforts, hopeful that we will 25. Thank you, Farhana.
Thank you.